And if an outbreak occurs in the United States, I have no evidence that you would not use your role as secretary to spread dangerous misinformation. So that one incident, from my perspective, disqualifies you from holding any position in healthcare, much less the number one health official in the United States. And 75 Nobel Prize winners in science have said very clearly that you should not be confirmed, that it would be dangerous for you to have.
And you should look at their conflicts,
So
you should look at their conflicts of those individuals.
Well, 75
and
Nobel.
You should look at who financed that letter.
75 Nobel Prize winners, and by the way, of a high percentage of the medical community in Boston, the health capital of the United States and the world, have said the same thing about your qualifications. They're saying to me they don't want tiny coffins as well. Neither do I. So that's the basis of my reservations about you, and the reason why I'm going to vote no on your candidacy, because I just think it's too dangerous to run the threat that that misinformation is spread in our country in the same way it was in Samoa.
Senator Murkowski, and let me compliment Mullen and Murkowski. They've stayed here the entire conference, and they're not obligated to like the two of us, not that we wouldn't have otherwise. But Senator Murkowski, you please.
Thank you, Mr. Chairman. And I think these are exactly the types of forums that we all need to be engaged in from start to finish. Because
can you speak up, Senator Murkowski?
There has been there's been considerable discussion here about many issues. Certainly a lot about vaccines. I care deeply about making sure that our vaccines are safe, the efficacy of them, the availability of them, how we disseminate them is particularly important in a very, very rural state like mine. You have experience there. You understand that. I am particularly attracted by the focus on chronic diseases. We know that if we can do a better job with chronic diseases, maybe some of the other things that we are susceptible to in the infectious diseases area, we're able to perhaps pull back a little bit on that. But our reality is, in order to make this country healthy again, it is a focus on everything. It is the prevention. It is the necessity of coming up with these life-saving vaccines that are going to be so critically important. It is personal care. It is food. It is exercise. It is all of the above. And we got to figure it out together. We do need to shake some things up, but we also need to give a level of confidence. And this is what I'm hearing from so many of my colleagues who have raised the issue of vaccines. We have made some considerable gains in my state of Alaska with vaccinating the many people in very rural areas where one disease outbreak can wipe out an entire village. We saw this in 1918 with the Spanish flu, and that's why everyone was rattled to the core. Villages were shut down entirely during COVID because of the fear of transmission. And so they're looking for these life-saving ways and means. And so when there is a lack of confidence, when there is a doubt, it's like, well, what do I do? And so we're pulling back then on, again, these areas where we can work to prevent some of these deadly diseases that we thought we had wiped out years ago. We have dramatically reduced diseases in my state like Hep A and B and meningitis. We're just now getting through a tough bout of whooping cough that came around to the state. Now there's a scare in the peninsula in Alaska about a measles outbreak. So we can't be going backwards with our vaccinations that will allow for this level of prevention and protection. So I'm asking you, you are clearly an influencer. You are clearly an influencer. You would not be in this position today. But you can see how your podium, your platform, your voice can influence so many. So I am asking you on the issue of vaccines specifically to please convey with a level of authority and science, but also with a level of conviction and free of conflict and free of political bias, that these are measures that we should be proud of as a country. Proud of as a country. Look to what President Trump was able to do with the COVID vaccine. It was extraordinary, and it did save lives. I need time for a question, so I'm asking you to focus on how you can use your position to provide for greater levels of confidence to the public when it comes to these life-saving areas. So I'm going to pivot to a question that you can answer. This relates.
I can answer that one, too.
No, I know, but I have 43 seconds, and no one has talked about our Native populations. When you look at our health statistics, whether it's Alaska Natives or whether it is American Indians, our health statistics in this country, you know very well, because we talked about them, are not where they need to be. And it's in all categories. It's infectious disease, it's tuberculosis, it's Hep C, it's mental health, it's depression, it's substance use, it's sexually transmitted diseases, it's hypertension, stroke. It is so deep, and it is so challenging, and it is so hard. You have received support from Native American tribes. You have been in these areas. You have been quoted, and I'd like for your comment on this, as quoted saying, as far as budgeting for Indian country, you said you would immediately triple the budget to support tribes. Can you expand on this pledge and the commitment? Because this is an area where we have truly left our Native people behind when it comes to their health and their health outcomes.
Yeah, thank you, Senator. And, you know, this is an issue, as you and I talked about, that is very important. It's always been a priority for me. I spent 20% of my career working on Native issues. I was one of the founding editors of Indian Country Today, which is the biggest Indian newspaper. My father and uncle, Ted Kennedy, my father, were deeply, deeply critical of the functioning of the Indian Health Service back in 1968 to 1980, and nothing's changed. Nothing's gotten better. I'm going to bring in a Native at the Assistant Secretary level. I'd like to get him actually designated as a Assistant Secretary for the first time in American history. Make sure that all of the decisions that we make in our agency are conscious of their impacts on the First Nations. I've spent a lot of time in your state. It's my favorite place to go. I've been up with the Gwich'in, representing the Gwich'in people up in Arctic Village, and been all over the state in the remote areas. I understand in Alaska, the unique needs of Alaska because of remote health care, because some of these areas are not even accessible except for airplane. If they don't have ambulance services, that the federal government needs to pay attention to financing transportation, the unusual ways that are required there, and that we really need to focus on telemedicine and AI. Make sure that even in remote places in Alaska, that Native people can get high-quality health care, and we can do that today. And I look forward to working with you on those issues and others.
Thank you, Mr. Chairman.
Senator Murkowski sets the record for going over. Senator Also Brooks.
Sorry.
Good morning. Thank you, Mr. Chair. Mr. Kennedy, I was struck by your comments during our meeting last week.
What?
I was struck by your comments in our meeting last week, where you made it abundantly clear to me that you intended to clean house of the professional scientists at the National Institutes of Health, which you know is headquartered in the state of Maryland and employs thousands of hardworking Marylanders. I, for the record, believe in scientists, and I believe in doctors, and I trust them over politicians without medical degrees. You talked about bad science and bad scientists, and in fact, you specifically said to me in response to my question that you intend to replace the bad scientist with the good scientist. And so I want to ask you, in your opinion, what makes a scientist or a doctor qualified to serve at the National Institutes of Health?
A scientist who's devoted to empirical methodology, to evidence-based science, scientists who understand the importance of replication, importance of publishing raw data and being open and transparent about it, the importance of publishing peer review. We have, NIH has overseen over the past several years the decline, the precipitous decline in American health. There's 91,000 people at HHS, and are you suggesting that some of them should not be held responsible for that decline? They were in charge of protecting our health.
Let me just insert here.
Let me just finish.
Well, let me
by
just say
saying
this, because I only have 3 minutes left. I don't set the rules here, but I ask the questions. And the question is really whether you intend, as you said, to substitute essentially your judgment for the judgment of these professional scientists and doctors.
I'm not going to substitute my judgment for science. Of course, I'm not going to do that. What I'm going to do, listen, the New York Times just did an article last week talking about the fraud, the 20-year fraud, 800 fraudulent studies produced by NIH on amyloid plaques, and not allowing any other hypothesis about the cause of Alzheimer's
Well, how
to be
will you
explored.
decide, Mr. Kennedy, which scientists
The ones
are
who
bad scientists? Are they the ones who disagree with you?
The ones who are corrupt, the ones who have been doing science like the amyloid plaque studies that were fraudulent.
Well, these doctors, let me ask you a question. Do you have a medical degree?
Do I know?
Okay, let me go to the next question. The Heritage Fund has compiled a watch list of federal employees to go after federal staff. Is there a watch list for federal staff at HHS?
Not that I know of.
Have you or has anyone in the administration developed a list of career scientists or federal staff that you would target for termination?
Not that I know of.
And let me just ask you another question. Now, your failed presidential campaign has been raising money to try and cover your debts. And you were questioned about this yesterday and failed to answer a question that Senator Warren asked you. And so I want to ask you again regarding these emails that you have sent to raise money. How much has your presidential campaign made fundraising off of this administration's complete disregard for the workforce at HHS?
Excuse me? I didn't hear the question. The last part.
How much money has your presidential campaign made off of fundraising, off of this administration's complete disregard for the workforce at HHS?
Zero.
Okay, Mr. Chair, I'd like to ask unanimous consent to enter into the record 2 emails from this week and the week before regarding fundraising that you are currently doing through your presidential campaign.
Without objection.
And finally, I want to ask you, I have you said you were on a show on February 26, 2021, an interview with Dr. Judy Mikovits, where you said the following, and I quote, "We should not be giving Black people the same vaccine schedule that's given to whites because their immune system is better than ours." Can you please explain what you meant?
There's a series of studies, I think most of them by Poland, that show that to particular antigens that Blacks have a much stronger reaction. There's differences in reaction to different products by different races.
So I have 17 seconds left. Let me just ask you then. So what different vaccine schedule would you say I should have received? What different vaccine schedule should I have received?
I mean, the Poland article suggests that Blacks need fewer antigens than...
This is so
So
dangerous.
you get the same measles vaccine.
Mr. Kennedy, with all due respect, that is so dangerous. Your voice would be a voice that parents would listen to. That is so dangerous. I will be voting against your nomination because your views are dangerous to our state and to our country.
I mean, do you think science is dangerous, Senator? This is published, peer-reviewed studies.
I yield.
Senator Collins, who would have been here the whole time, but she was in an Intel committee. So, Senator Collins.
Thank you, Mr. Chairman. Mr. Kennedy, welcome, first of all. I agree with you that there needs to be more focus on chronic diseases like diabetes, like Alzheimer's. But it concerns me when I read a quote from you that says, I'm going to say to NIH scientists, God bless you all. Thank you for your public service. We're going to give infectious diseases a break for about 8 years. Don't we need to do both? Don't
Yes, absolutely, Senator. The problem is there's been an imbalance. We've devoted all of these dollars to infectious disease and to drug development to make NIH an incubator for the pharmaceutical industry, and very little to chronic disease. But chronic disease is 92% of deaths in our country. It's 9 out of every $10 we spend on our budget. Why aren't we devoting at least equivalent studies to determining the etiology of our chronic disease? It just seems like common sense to me.
I would point out that in many cases it's Congress rather than HHS who sets the funding levels for various diseases.
But NIH decides, has panels that decide who gets funding, not Congress, Senator.
I want to share with you a discussion that I had with the Maine pediatric nurse practitioner. She raised the concern that if people are discouraged from getting their children vaccinated, we will lose the herd immunity in a classroom. And that means that a child who may be immunosuppressed and cannot get a vaccine are at risk of being in a classroom with an unvaccinated child, and thus at risk of getting the infectious disease because we've lost the herd immunity. What would be your response to that?
My response is that vaccine uptake for the COVID vaccine, for example, is down to 23%. And all vaccines are dropping, and they're doing that because people don't believe the government anymore. We need good science, and I'm going to bring that in. I'm going to restore trust, and that will restore vaccine uptake.
Well, you're certainly correct about what happened with the COVID vaccine, but let me switch to the polio vaccine. Do you think that the polio vaccine is safe and effective?
Yes, I do.
And so would you seek to reduce its availability in any way?
No, not at all.
The state of Maine has seen a steady and disturbing increase in Lyme disease cases over the past decade. We talked a little bit about this in my office. In 2023, Maine had a record number of Lyme disease cases, nearly 3,000 reported cases. Fortunately, there is a promising vaccine trial for Lyme disease that is underway at Maine Health in Portland. Access to a Lyme disease would be a monumental step forward in reducing the burden of this disease, which can have lifelong effects. I've seen it in members of my own family. As HHS Secretary have confirmed, what influence would you exercise over new vaccine approvals, such as one for Lyme disease?
Senator, you and I have talked about this issue. I've had Lyme disease. I lived in the epicenter of Lyme disease. Every member of my family my immediate family has had Lyme disease. I had a son whose face was paralyzed for a year. I have a son today who has been suffering with devastating effects from Lyme disease for 2 years. There's nobody who will fight harder to find a vaccine or a treatment for Lyme disease than me.
I very much appreciate that assurance, and I'm sorry that your own family has been so adversely affected. In Maine, we have a lot of people who work outside and work in the woods, and ticks are everywhere. So this is a very important issue to me. Thank you.
And to me too, Senator.
We're almost to the end. Let me acknowledge Senator Moody has also been here the whole time. And so thank you, Senator Moody. Yeah, well, just incredible diligence. Thank you. Both Senator Sanders and I will have a couple questions, and then we'll each have a closing statement, and then your long national nightmare will be over. So anyway, first, a couple more of commit-type questions. If you are confirmed, do you commit that you will not work to impound, divert, or otherwise reduce any funding appropriated by Congress for the purpose of vaccination programs?
Yes.
And do you commit that you will not impose new grant conditions outside of congressional direction for state, local, or global entities that in any way limits, restricts, or rescinds access to vaccines or vaccine promotion programs?
Yes.
And then this is the nice thing about listening to all of this. Let me ask this. I've been impressed. One, you've handled yourself very well. I've been impressed that on many things you are familiar with recent medical data. But on other things, you haven't been. So let me bring up two things which are very pertinent now. While sitting here, I went up to look at the medical literature on these issues. And here's the title, Why Parents Say No to Having Their Children Vaccinated Against Measles, a systemic review of the social determinants of parental perceptions on MMR vaccine hesitancy. And they found that fear of autism is a major driver for vaccine hesitancy among those with a college education or higher, influenced by internet social media narratives over physician-based vaccine information. I'll go back to something I said earlier. You got to follow it, man. There's a lot of people that look to you for, do I get vaccinated or not? People that I kind of know. But here it says it's not just my anecdote, it's actually out there. But when I raised, and you said, well, if I show you the data, you'll change your, because I asked, will you, without qualifications say that measles vaccine does not cause autism. And you said if I show you the data.
I will publicly apologize
So here's
and say that I was wrong.
Here's a meta-analysis from 2014, and you quoted Cochrane on several occasions, which for the people watching is a meta-analysis. A meta meaning they look at everything and then they come to a conclusion based on as much as they and here is such a study. And the title tells it all. Vaccines are not associated with autism, an evidence-based meta-analysis of case control and cohort studies. And they ended up looking at 5 cohort studies with roughly 1.2 million children. Now, this is from 2014, and it has a whole bunch of articles it references. And then I got a text from a former employee of the NIH, I emphasize the former, who says that in early in the President Trump's term, you and colleagues sent 90 papers for review by people at NIH. They felt like the NIH folks felt that without exception, they were severely lacking methodologically, and are found that they indeed showed the safety of these vaccines. We tried to engage Mr. Kennedy, but his colleagues refused to acknowledge the expertise of dozens of NIH scientists we made about those papers. Now, you're a smart guy. You're reading the medical literature, and you're coming up with the recent medical literature on certain issues. But here is both older article, summarizing lots of older articles that have come out since the original refuted Wakefield article in The Lancet regarding measles and autism. And here is somebody who, you know, it's he said, but somebody who said that previously you've had this presented to you. So back to me. I'm a doc trying to understand. Convince me that you will become the public health advocate, but not just churn old information so that there's never a conclusion. as Senator Hassan suggested, but that will become the influencer for people to believe, no, there's 1.25 million kids studied and there's no autism associated with measles. How do, you tell me, you see what my question is in there.
Senator, I'm going to be an advocate for strong science. You show me those scientific studies, and you and I can meet about it. And there are other studies as well, and I'd love to show those to you. There was a study that came out last week of 47,000 9-year-olds in the Medicaid system in Florida by I think a Louisiana scientist called Mawson that shows the opposite. So there are other studies out there. I just want to follow the science. And I will do, if the science says that I am wrong about what I've said in the past, as I said, I will publicly apologize. There's many times I've been wrong about science. If you look at my Instagram account, when I'm wrong, I apologize for it. And I say I was wrong. I don't have any problem. Science is a process of challenging hypotheses with new evidence. And scientists have to be able to admit when they're wrong. Epidemiological studies, the Institute of Medicine has said repeatedly in 2013, 2017, when they investigated this, has asked CDC to do certain studies, animal studies, bench studies, observational studies, studies of the vaccine safety data link. CDC has not done that. Oh, I want them to do that, and I want the best science. I can guarantee you, on my word of honor, and if you show me science that says that I'm wrong, I'm going to say I was wrong. I don't have any problem. There's nothing that would make me happier. We need to be able to look at the science and get IOM involved, the National Academy of Sciences. They're the ultimate arbiter of safety.
What was that?
And you know what? One of the things we need to do, I think, is a subject that we haven't talked about here. Why don't we know what's causing this epidemic? Why hasn't CDC been looking at other hypotheses to determine the etiology of why we've had this dramatic 1,000% increase in this disease that is destroying our kids? It's probably the biggest issue. Why don't we know the answer after 30 years of steady rises in autism rates? I don't know. We know the answer to that. We should know the answer.
What was that? What was that last article? Did you mention?
That article is by Mawson, M-A-W-S-O-N.
And it's regarding measles and what?
No, it looks at the entire schedule, and it says it's a study of 9-year-old boys, 47,000 9-year-old boys from the Florida healthcare data.
Okay, let me, Senator Sanders.
Thank you. And I find myself in the unusual and uncomfortable position of having to agree with Senator Cassidy's line of questioning. Mr. Kennedy, in an interview in July 2023, you stated, quote, "I do believe autism does come from vaccines." And you have, the end of quote, and you have praised a gentleman named Andrew Wakefield for his research. What studies, you talk about the need to be science-based, to get our information, good information to make decisions. What studies have you utilized to come to the conclusion that vaccines cause autism?
I'm happy to sit down with you.
No, please, just answer me that.
I mean, look at the Mawson study, Senator.
The what? Yeah,
Mawson, just look at that study.
yeah, I will, and that was published.
But I don't want to, I wouldn't rest on a single study.
Right.
And all studies can be
Okay, don't mean to be rude. I don't have a lot of time.
Just saying
you would not be, I just heard you say you could not be happier if you were proved wrong. Mr. Chairman, I asked to put into the record 16 studies done by scientists and doctors all over the world saying that vaccines do not cause autism. Are you happy without objection?
Look at the IOM assessment of those 16 studies, Senator. The IOM has assessed them. But listen,
Let me get to don't have a lot of time.
I am
I
not-
apologize. I'm happy to talk to you at another time. Don't have a lot of time. Let's talk about COVID. And I just want clarity on the issue. And again, I apologize. You have to be brief. We don't have a lot of time. Scientists have estimated that the COVID vaccine saved 3 million lives. President Trump said the COVID vaccine was, what, quote, one of the great miracles of the ages, end quote. You have said the COVID vaccine was the deadliest vaccine ever made, end of quote. Was the COVID vaccine the deadliest vaccine ever made?
The reason I said that, Senator Sanders, is because there were more reports on the VAERS system, on the Vaccine Adverse Event Reporting System, which is the only surveillance system, that and VSafe. And there were more reports of injuries and deaths than any other, than all other vaccines combined.
But was it the scientists said it saved 3 million
According
lives?
to VAERS. I don't know, because we don't have a good surveillance system. So
So you
can answer
disagree
that
with the
question.
scientific community that...
Oh, I'm agnostic because we don't have the science to make that determination.
Really? Okay. Prescription drug prices in America, as you know.
And by the way, I think President Trump did an extraordinary job on warp speed because he wasn't just focusing on that one intervention. He was focusing
He called it a
whole
miracle, but you have cast doubts on its efficacy. All right. Prescription drugs. We're going to make America healthy. I agree with you that we have to need a revolution in the nature of food in America, physical exercise, et cetera. Very, very important. But there are people who are going to get sick, and they have to go to the doctor and find out why. 1 out of 4 Americans today cannot afford the prescription drugs their doctors prescribe because we pay by far the highest prices in the world for prescription drugs. We made some progress under the Biden administration of negotiating prescription drug prices with pharma. First time that's ever happened. Now, yesterday you told me that the White House was going to issue something affirming their support for continuing those Medicare negotiations. Turned out not to be quite accurate. They came up with some bland statement, could have been written by pharma. Very specific questions. Do you believe and will you insist that Medicare continue to negotiate prices with the pharmaceutical industry so we can substantially lower prescription drug costs in America?
President Trump has made it very clear to me that he wants to negotiate.
Negotiate is a big word, Bobby. It's a big word.
It's the word you just used, Senator.
Yeah, but no, I use defend a particular law. Will you defend the law in the Inflation Reduction Act, which already is negotiating prescription drug prices?
President Trump wants us to negotiate drug pricing. He wants to
But you're
lower
not-
drug prices.
So you're not telling me that you will defend the law that we passed, which has already had significant success?
Well, Congress, look, I'm going to comply with the law, Senator. Congress passed the law. I'm swearing an oath to the Constitution. I'm going to comply
You're
with the
going to have a
laws.
significant influence on healthcare policy if you are.
And I'm going to comply with the laws.
Let me just say this in conclusion, Chairman Cassidy. President Trump and Mr. Kennedy are quite right when they say that our system is broken. They're right. Our economic system today is broken. 3 people own more wealth than the bottom half of American society. Wages have been stagnant for American workers for 50 years. The economy is broken. You know what? Our political system is broken and corrupt. You have a handful of billionaires in both political parties who contribute huge amounts of money to elect candidates in this room throughout the United States Congress. That is a broken political system and a real threat to democracy. Our healthcare system is broken. And it's broken for some of the reasons that Mr. Kennedy indicated. We have not paid attention to the fact that we have massive amounts of chronic disease. We have not answered the question why in the richest country in the history of the world, our life expectancy is lower than it is in countries far poorer than we are. So I think in many ways, President Trump and Mr. Kennedy have asked some of the right questions. Problem is their answers will only make a bad situation worse. So let me ask Mr. Kennedy again. if we want to make America healthy, will you assure the American people that you will fight to do what every other major country on earth does, guarantee health care to every single American?
I'm going to make America healthier than other countries in the world right now.
Will
we're the
you
sickest.
guarantee do what every other major country does? It's a simple question, Bobby.
And by the way, Bernie, the problem of corruption is not just in the federal agencies, it's in Congress too. Almost all the members of this panel are accepting, including yourself, are accepting millions of dollars from the pharmaceutical industry.
Oh, no,
and
no,
protecting their interests.
Oh, I thought that would come. No. I ran for president like you. I got millions and millions of contributions. They did not come from the executives, not one nickel of PAC money from the pharmaceutical industry. They came from workers.
In 2020, you were the single largest
Because I had
receiver of pharmaceutical money.
contributions from workers all over this country. Workers,
You were the
not a nickel from corporate
Bernie,
tax.
you were the single largest acceptor of pharmaceutical dollars.
No, from workers in the industry.
1.5 million.
Yeah, out of 200 million. All right, but you have not answered, last question. You have not answered my question.
Mr. Chairman, we're 3 minutes.
Ask you a question.
How do we make America healthy if you don't guarantee health
Chairman,
care
we're
to all
literally
people?
3 minutes over here now.
Well, so are other
How long
people.
does it keep going? At some time, you're just battering the witness,
Not
Bernie.
battering the whistles. I'm
Yes,
trying
you
to get
are.
an answer.
And you're getting upset at him. You're going at him just like anybody else would.
We'll come to order. Bernie, he's going over. Before I ever entered politics, before I was ever thinking about running for office, I practiced medicine for 30 years. I worked in public hospitals in California, Louisiana, specializing in liver disease, caring for those who otherwise would not have had a specialist. If you will, dedicating my life to saving lives. That is, being a doctor. That ethic guides me now. In my opening statement, I told the story of my patient, an 18-year-old girl with acute liver failure from hepatitis B being air ambulanced to LSU Shreveport Hospital for a liver transplant. Now, let me finish the story. Her mother wasn't allowed to fly in the helicopter, so her mother drove the 3 hours from Baton Rouge to Shreveport. Now, when she arrived, they let her visit her daughter before she went back to the OR. And the mom goes in to say a prayer, squeezes the daughter's hand. The daughter's eyes open, and she said, "Mama?" And the daughter began to recover. Powerful story with a happy ending. But as a doctor, I saw endings not so happy. I just had a friend text me, 2 children died in an intensive care unit in a Baton Rouge hospital from vaccine-preventable diseases this past month. So my concern is that if there's any false note, any undermining of a mama's trust in vaccines, another person will die from a vaccine-preventable disease. Now, you've got a megaphone. Maybe you and Bernie, Bobby and Bernie. Of everybody in this room, the 2 of you have the biggest followings, tremendous credibility. And with that influence comes a great responsibility. Now, my responsibility is to learn, try and determine if you can be trusted to support the best public health. A worthy movement called MAHA to improve the health of Americans, or to undermine it, always asking for more evidence and never accepting the evidence that is there. I looked at the article from Dr. Mawson, and it seems to have some issues. I'll just put that to the side. And that is why I've been struggling with your nomination. There are issues ultra-processed food, obesity, we are simpatico. We're completely aligned. And as someone who has discussed immunizations with thousands of people, I understand that mothers want reassurance that the vaccine their child is receiving is necessary, safe, and effective. We agree on that point, the 2 of us, but we've approached it differently. And I think I can say that I've approached it using the preponderance of evidence to reassure, and you have approached using selected evidence to cast doubt. Now, put differently, we're about the same age. Does a 70-year-old man, 71-year-old man who spent decades criticizing vaccines and who's financially vested in finding fault with vaccines, can he change his attitudes and approach now that he'll have the most important position influencing vaccine policy in the United States? Will you continue what you have been, or will you overturn a new leaf at age 70? I recognize, man, if you come out unequivocally, vaccines are safe, it does not cause autism, that would have an incredible impact. That's your power. So what's it going to be? Will it be using the credibility to support lots of articles, or will it be using credibility to undermine? And I got to figure that out for my vote. You have the power to help rebuild, to help public health institutions re-earn the trust of the American people. Now, let's be political. I'm a Republican. I represent the amazing state of Louisiana. And as a patriotic American, I want President Trump's policies to succeed in making America and Americans more secure, more prosperous, healthier. But if there's someone that is not vaccinated because of policies or attitudes you bring to the department, and there's another 18-year-old who dies of a vaccine-preventable disease, helicoptered away, God forbid dies, it'll be blown up in the press. The greatest tragedy will be her death, but I can also tell you an associated tragedy that will cast a shadow over President Trump's legacy, which I want to be the absolute best legacy it can be. So that's my dilemma, man. And you may be hearing from me over the weekend. You may be hearing from me over the weekend. I once again thank you for your time, and I yield to my ranking member.
Thank you, Mr. Chairman, and thank you very much for your job today in conducting this very, very important hearing. Let me reiterate my concerns. Every person on this panel, and I would hope everybody in America, wants to make us the healthiest country on earth. And I applaud Mr. Kennedy for raising the issues and talking about some very important truths. But what I am not hearing from him are some very specific policy issues that we absolutely need if we're going to make America healthy. It is unquestionable that when 68,000 Americans die because they can't afford to go to a doctor, you got to deal with that. And I have not heard one word about the need for universal health care that exists in every country on earth. When 1 out of 4 people can't afford prescription drugs because the pharmaceutical industry is ripping us off and charging us 10 times more in some cases than the people in other countries. I have not heard the definitive answer I need that we're not going to pay the highest prices in the world for prescription drugs. And one of the points I think that Mr. Kennedy made, which is right, healthcare is not just medical care. It's a lot more. Talk about the food industry. We have held a hearing, Senator Cassidy and I held a hearing a couple of months ago, where we made the point that the food industry is, in fact, poisoning our kids with addictive food that is leading to obesity, diabetes, heart conditions, etc. And I hope that our Congress and the White House will have the courage to take on a very powerful food industry and demand that the products that they sell our kids are in fact healthy and non-addictive. In many ways, what the food industry is doing today is what the tobacco industry did 50 or 60 years ago. And we talk about making America healthy today. Again, it's not just doctor care, medical care. We have millions of people working for starvation wages. You cannot be healthy if you're working 50 or 60 hours a week and you can't afford the rent that your landlord is charging you. Stress kills. Stress makes us sick. So, Mr. Chairman, let me just say this. I think the issues that have been raised in this hearing today are of enormous importance. I look forward to working with you and other members of this committee to make sure that we develop the policies that have the courage to take on very powerful and wealthy special interests. So, in fact, that we can make America healthy. Thank you.
This concludes our hearing. For any senators who wish to ask additional questions, questions for the record will be due tomorrow on Friday, January 31st at 5 p.m.
All right, we just ended the second day of the confirmation hearing with RFK Jr., a very fiery and passionate day 2 of that hearing. That is it. The vote is on now from yesterday's day 1 hearing. Let's go now to, because Washington, D.C. is very busy today with Tulsi Gabbard. Yeah, her hearing as the Director of National Intelligence with the Senate Intelligence Committee. Let's go now to the Senate confirmation hearing of Kash Patel, Trump's pick to lead the FBI at the Senate Judiciary Committee. Let's listen in.
Wanted to get these records. And then during that hearing that you're recognizing, sir, or that you're mentioning, I sought recognition. It was not my Republican colleagues that ended that hearing. Mr. Chairman, you